As you know, we've been in this county for years now. Seems like it's hard to do this. We've been on the Baptist Hospital in 2,400 square feet, and that's served us exceptionally well. Over that time span, more than 50,000 people have had medical visits.
And I'm not trying to stop you, but if you wouldn't mind, would you hold the mic pretty close to your mouth? Because I can't turn it up. I've tried.
Okay. So we're on the campus of the hospital, and we have seen about 50,000 patients in that 11 years. We're 2,400 square feet, which if you came and looked in the clinic right now, you'd go, oh my gosh. I mean, there's stuff stacked everywhere, including your contribution of a exam table, wall units for these new exam rooms we have, chairs, etc. They're all just piled in there. There's no room to put anything else in that building. Baptist has been generous and is giving us additional space. We'll move from the back building to the front building, and it'll be 3,600 square feet. Bill Landis, 50% more than what we've got now. We'll go from 4 to 6 exam rooms. We have our pharmacy, which we opened in 2021, where we provide basic medications to our patients at no cost. Is in an 8x8 room now. It will be 70% larger, allowing us to put more medications out and able to provide more medications to our patients that they do not have to pay for. Last year, we dispensed about $1.2 million in retail value of medications. Much of it is diabetics, pulmonary, cardiac medications. That what we found before we started this process was our patients just didn't get the medications filled. We have one medication that for 1 month, the patient, it would cost them $800 for that medication. They're able to get it free at no cost. And we are seeing tremendous improvement in the health of these patients who are diabetics and have other issues just by having medications available to them. We have a volunteer pharmacist. We're completely licensed by the state of Kentucky. So we're just like your Walmart or Kroger, except that we're not retail. And we serve just our population. One of the other things that's been really valuable for us has been seeing how the face of the patients that come to us has changed. We always have served patients with acute or chronic issues, but what we're beginning to see over the last year is patients coming in with extremely serious health conditions. I got a phone call last Friday from Baptist Radiology. And one of our patients that we had sent for a CT had a lung, her left lung was the size of a baby's fist. She'd had untreated tuberculosis as a child, and now that patient's facing a lung transplant at some point down the road. That's just an example of one example of what we're beginning to see with people coming to our clinic. We don't know why. I don't know if it's because people have been without medical care in other areas and they're just now, or they've lost insurance, and they're just now coming for care. But it's been significant to see that happening amongst our patients. We have a volunteer staff who runs the front desk, volunteer pharmacists. They have 4 volunteer nurses. Right now, we have 2 paid nurse practitioner positions, unpaid development, which is Taylor, myself, and then we have 2 part-time nurses. The rest of the people there are totally volunteers. We are completely electronic records, just like your doctor's office. So we've reduced the number of volunteers needed to run the clinic because we're so much more efficient now in what we do and totally up to speed with what healthcare is today as well. It's been a journey to get there. If you can imagine, a lot of our volunteers were in their 70s and trying to teach them that transition was an interesting journey. But they've made it, and it's been really great. We recently hired a practice manager so that I'm not tied to that building every day of the week. I'm able to get out and get around and help Taylor and then just be more involved in the community, which I'm really looking forward to that. That's been a long time ago, right, Bill Landis? Yeah. Our patients are ages 4 and above. We're seeing more children than we've ever seen before. We're getting referrals to the clinic. I had the school system call yesterday. They had 2 high needs, one which we could help them with, and the second one we couldn't. But we were able to go out and find where these people could get the additional care. So we become a resource, not only just a delivery of a product, but we're a resource to the community as well. I'm not switching the slides. Sorry about that. Yeah. Technically. Baptist has also been very wonderful to us to provide us with specialty care. These people that are having health conditions that are outside of a primary care practice, we're able to send to Baptist and they get the specialty care that they need. So in addition to providing us with space, I know, by the way, that space is provided to us at $1 a year. And they pay our gas and electric, which is worth close to about $70,000 a year to our annual budget. Patient visits are still $15. Have the next one. The in-house pharmacy. Here's an interesting fact. Most people would think that our patients are employed. 97% of them are employed. They're in low-wage jobs. They're taking care of your car, your kids, the daycare, the part-time school bus drivers. They work in your Kroger's and your Walmart, your box stores, or they're self-employed. So they don't have the ability to get health care at an affordable rate. And again, we've been in the community 11 years. I'm going to let Taylor take it from here for the financial part.
Hello, my name is Taylor Davis. I'm the Development Mission Awareness Associate here at Hope Health Clinic. So this is a large project for the clinic. The price we got it to, we're going to have to raise $235,000. We have currently raised $148,750, which is amazing. We still need to raise $86,250. Demolition on the new clinic began October 27th. We are using contracting solutions and they've been very gracious to us. Their business coordinator, Julie, has reached out to many subcontractors to volunteer their time and get items donated so that we could get this price as low as possible. But we still need the community's help. We've taken a 5-year loan for this project and we're hoping to get it paid off as soon as possible so our main focus can be our patients. So how can you help? Oh, you can invest in Hope Health Clinic in our expansion fund. Again, we need to raise $86,250, and we're hoping to get that as soon as possible, hopefully before the clinic can open. If you're a business owner or if you know someone that owns a business, please come contact me. I'll give you cards with all our information. They can offer their employees our health clinic. So that can be a huge help for us. We've had thousands and thousands, was it 50,000 patients?
More than 50,000 patient visits.
More than 50,000 patient visits since we've opened. Also, word of mouth. Let your family and friends know about Hope Health Clinic. Word of mouth is huge for exposure for us. Also, social media. If you are on Facebook or Instagram or know someone who is, we do a lot of updates and we keep everyone updated on our Facebook and Instagram, especially with the demolition. You'll see insight of what's going on and the updates to come. We also do a mailing list. If you're not on our mailing list and you would like to be, please reach out to me. I can get your email, your address, and we can send you our newsletter or add you to our emailing list. We will have a big grand opening once the new clinic is open. We're hoping that it's the beginning of 2023. That's the goal.
Early part. Yeah.
Early part, yes. We're still not for sure yet. But come and visit us in the meantime. Come see what the clinic looks like if you don't have any idea or if you don't know where we're even located. So when you tell your family and friends about us, you can give more detail about all the things we do for the community. Thank you.
Yeah, I got a question.
Yes.
Can churches donate to this expansion fund?
Yes.
The
Absolutely.
churches can too. So
Absolutely.
if anybody here goes to a church and they ask their pastor, do we donate to Hope Health Clinic? That would be good. Yeah, yeah. And if they say, yes, we do, then they could ask,
For a
how
low
long has
offering.
it been the last time since we donate to Hope Health Clinic? Because they've got this expansion going on, right?
Right.
So that'd be really good to see a bunch of new churches get back.
We have 24 churches that support us now, so we're always open to more.
That's about half of Oldham County, almost half of Oldham County.
Right. And I'd also like to thank Fran Scott. Fran generously and worked with me tirelessly to do the architectural plans for this expansion, saving us money as well. And this will be a first-class facility for our patients. Look just like a brand new Baptist office. It's going to be beautiful, and they deserve it. They deserve the same thing all the rest of us have, and it is going to be an amazing, amazing facility. Other questions?
Does the county government give anything from their COVID funds or leftover?
Yes, and I do not know the exact amount, but yes, I do know that there is a fund, a gift coming to us the first of the year. Other questions? Well, again, please feel free to come and we invite you to come and visit with us.
Oh, I got a
anytime.
question.
Yes.
So I know that HOPE is a national award-winning service organization. What's been your favorite experience when you've gone to travel and received some award for the work of HOPE?
Well, we're part of the National Association of Free and Charitable Clinics. And one of the things that I have found that's always been amazing to me, many of these clinics that are high-level award winners have $10, $20 million budgets. Our cash budget's around $400,000, and we are able to do much of the same thing for the patients that are in our clinics that these other clinics have, much larger budgets, and most of them are employed, fully employed. They also have dental down the road. That's a dream of ours too. The first place is to get to this expanded space so that we can see more people. Yes, Bill.
As Baptist, we calculate how much money that you are saving them on an annual basis.
I don't believe so, but I would love to talk to you about how to do that. I would love to pick your brain.
These guys right here, we have a pretty good handle on that from the beginning.
Right. In the beginning, we had a strong record of how many people came through the ER and that were sent to our clinic. When the new electronic record system Epic was installed, the ability, we were considered as a provider in the old system. We aren't in the new one. But I do know that Baptist, every patient that comes to the emergency room who doesn't have a primary care doctor, who does not have insurance, is directed to us immediately. We are faxed their electronic records and their visit notes, and we contact them immediately about setting an appointment. And I would probably say 80% of them do make appointments and keep the appointments. Anybody else? Well, thank you so much. We greatly appreciate you having us again. And thank you so much for your gift. It's very, very helpful to us so that we can have that clinic fully stocked and ready to go the day we open.
Thank you, Janet and Taylor. You all are, we want to take seriously partnership with you all. So thank you very much for being here and sharing with us. Obviously, we know with the grant that we gave last year, it helped to Blaine, you want to speak to remind everybody what we helped to buy in that grant?
Well, I was gonna say, it was a $5,000 is what we, was actually over that. We wrote a little more than that,
This
but
one is about $800. The wall diagnostics, $1,200 a piece. And those are when you go to your doctor's office, ear, eye, all that stuff. And then cheers to